Dr. Minako Abe, welcome to the Tokyo Living Podcast.
Thank you so much for having me. I'm so excited to be here.
Yeah, a lot of our listeners will be familiar with you and the work that you do. And you were actually on Lance Lee's podcast, I believe, just a week or two ago. So I personally know a lot more about you than I did a week ago. But you have a really cool story. And I think it'd be good for you, as laborious as it would be, to share your life story on air for the second time in a couple of weeks. If you could give the listeners a bit of the background on, how you grew up and your story and your journey in medicine and what brought you to what you're doing at the moment.
Okay. So, thank you. I've been in Japan for the past 8 years now. As an adult, I lived here when I was a child. My first language is English, and I grew up for a bit in the United States, moved back to Japan, went through the American school system here. And then I moved back to the US, and decided to pursue medicine.
Yeah.
My father's a doctor too, so I was exposed to that as a child. And I just really, truly just wanted to help people.
Yeah. And what sort of ages? Yeah, I just get interested. What sort of ages were you where you made those transitions? Were you born in Tokyo? When did you then move to the States?
Okay, I was born actually in Sapporo, in Hokkaido.
Okay.
But I never really lived there. By 6 months, I had moved to the United States. My father was doing a fellowship. He was a cardiothoracic surgeon.
Okay.
So we lived there for about 5 or 6 years. And then I moved back to Japan at that point, not speaking a word of Japanese. And then so I went through the American school system. Mm-hmm.
Interesting. So where was your father working in the States? Where were you there?
He was at the University of Pennsylvania at UPenn,
Okay.
and then also at the Cleveland Clinic.
Right. Okay. And so your parents are both Japanese, but they sort of speak native level English as well, and they spoke to you in English growing up. Was that
They did. I mean, my mother and it's kind of a long story, but my mother actually grew up in China.
Okay.
And this was during World War II and then just past World War II. And she grew up speaking Chinese, but after they moved back to Japan after the war was over, she completely lost her ability to speak Chinese. So she always regretted that. So because of that, I think she really wanted me to make sure I spoke English and maintain my language in English.
Yeah.
And I think as a result, my Japanese has suffered a little bit.
Yeah.
But all in all, I would say it was worth it.
Yeah. And then you came back and you went through the American school in Japan. Is that
I did.
Yeah.
Yeah. And then after I graduated, I moved back to the United States, went to UC Berkeley.
Yeah.
And I really didn't think I would come back to Japan, but, I loved being in America. I ended up pursuing my medical degree.
Yep.
And I became an ER doctor in the United States.
Wow. Okay. And whereabouts were you practicing as an ER doctor?
So I practiced for about 15 years or so in New York City.
Okay.
And in New Jersey. Yeah. So that was a fun, exciting time. I love ER medicine. I love the immediacy of it, being able to help people, like people come in and then you can fix them up and send them on their way. So that was really gratifying in a way.
Yeah.
And so I love that. But after about 10 years or so of practicing ER medicine, I realized, I was seeing, a lot of the same patients over and over again.
Really?
A lot of chronic illnesses like asthmatics that would come in and they'd get better and go out but then they're back the next week, right?
Right.
There were so many things, like a lot of drug addiction, a lot of alcoholism, a lot of traumas. And I realized that 80% of what came through my doors could have potentially been prevented.
Yeah.
And that sort of started me thinking on the path of like, okay, well, I think we need to start treating people more upstream. That, putting a Band-Aid on them and sending them on their way wasn't really enough anymore. So I became interested in something called lifestyle medicine.
Yeah.
So lifestyle medicine is, again, sort of going back to sort of treating the root causes. Of course, you can't prevent everything, but even like 40% of cancers can be prevented.
Yeah.
And so that got me on the path of really lifestyle medicine.
Yeah, interesting.
Mm-hmm.
Yeah, I mean, it's I think it makes sense for a lot of people that more sort of chronic illnesses can be prevented through lifestyle management and that type of thing. But it's really interesting to hear, acute exacerbations of and the things that, I guess that sort of approach or your realization you wouldn't expect to come out of an ER doctor. You wouldn't expect that you would see or start to notice trends in terms of people's lifestyles affecting the things that would be presenting with in an acute sense. So that's really fascinating. Yeah. And even like with traumas and things you felt were leads to lifestyle.
Absolutely.
Yeah.
I mean, so much of traumas and car accidents are induced by, alcohol and drugs and lack of sleep. Just not getting enough sleep, is equivalent to not having the reaction time that you can.
Exactly. Yeah.
And that causes a lot of accidents there too.
Yeah, for sure. And so did you sort of move into cancer management before you came back to Japan, or what was the timeline there?
Right. So after I've been practicing about 15 years, my father, who runs his clinic, he actually transitioned from being a cardiothoracic surgeon into cancer management because he was
Right.
realizing that more and more, even though he trained and he actually was instrumental in bringing PTCA, the balloon, and stenting inside the heart, to Japan, most of his patients in Japan were not suffering from cardiac disease. They were suffering from cancer.
Mm.
So he became very interested in cancer management and treating with our own immune system. So we do cancer immunotherapy.
Okay.
And as he's 83 years old now,
Still practicing?
Still practicing
Wow.
coming in every single day. But he asked if I would come back to Japan to help him out. So 8 years ago, we made the big move and moved back to Japan, which is very difficult at first, but it was absolutely the right move. We moved back to Japan and I sort of had to relearn everything from scratch, including the Japanese language. And I also managed the lab that we have here because we can do something called regenerative medicine, which is actually taking your own immune cells from your body, through a blood draw, isolating your immune cells that fight against cancer, multiplying them, making them target your own cancer cell. And so that's what I do here. And with that, I also, notice that cancer patients have such a specific sort of need. Particularly in Japan, Japanese patients tend to just do what their doctors tell them to. And, they said, okay, go get surgery, do the chemo, do the radiation. And they're generally very compliant. But even in the Japanese population, they often wonder, like, well, how should I be eating? What kind of foods are good for me? I'm not sleeping. I'm really stressed out. Like all of these things, but they haven't, they really need more direction.
Yeah.
So with my lifestyle medicine background, there's actually a board of lifestyle medicine now in the United States. I became board certified in it. And, I felt like there's such a knowledge gap and that people don't really realize that they actually have a lot of agency over their own health. Of course, you can do every single thing right, eat right, sleep right, exercise all the time, and still get cancer, of course. But then there are patients, who smoke and drink all their lives and are healthy all their lives. But, the vast majority and the risk that you can manage and that your chances are so much better if you can manage your life. So I wanted to bring this sort of information to our patients here.
Yeah. Yeah.
Particularly with the expat population in the in Japan, the whole medical system is so foreign. People often say, I feel like a cog in the wheel. It's such a different system. And I think, the care here is truly excellent. But a lot of people need sort of help and guidance through that as they're managing a cancer diagnosis, saying, oh my gosh, they made me go through 10 different stations. And, they were asking me the same questions all the time. And don't, the doctors share information. And there's a lot of anxiety behind that. So, I help people to sort of understand what the system is like here, what the thought processes are behind them, and to sort of help them realize that, no, they truly are getting, if people who are expats decide to get treated in Japan, that they really, are getting excellent care because I think there's a lot of anxiety over that.
For sure. Yeah. And you have a interesting personal story, how you found out about the Japanese, especially the cancer management here. Perhaps if you can share a little bit about that and your husband's story.
Yeah, absolutely. So, about a year after I moved back to Japan, my husband was starting to have a whole lot of, back pains. And we just thought, oh, it's a herniated disc, he'll be fine. But, night after night, it was worse at night. I kept him up at night. So we said, okay, let's get the MRI. And we found that he had this large tumor in his spine. And it was very rare, and I freaked out, of course. I panicked thinking, oh my gosh, where's the best care that, my husband gets? So I contacted all my colleagues back in the United States and saying, what hospital should I take him to? Because, one miss and, he could be paralyzed for life. And, we weren't sure what we were dealing with at the time. But to my great surprise, all of my colleagues, some neurosurgeon colleagues were saying, no, no, stay where you are. Um, the hospitals, the technology that Japan has to offer, actually the best in the world.
Mhm.
So, trusting in that information, we chose a hospital for him to get treated in Japan, and everything actually worked out really great. I mean, the whole process of it again is so foreign, and you have to bring your own towels and your own PJs and whatever to the hospital, and you're hospitalized for days beforehand, and the hospital stays are much longer than they would have been in the United States, but the care I got was excellent,
Yeah.
and thank goodness everything worked out. And even though it was a very, very rare tumor, I think there were only about 7 cases that I found in the literature of his particular type of tumor. Thank goodness everything panned out really well. So
Yeah. And
for me, it was an awakening, that, we're always brainwashed. I think that, what you're used to, is the best care in the world.
yeah. Yeah.
But just because something is unfamiliar or different here doesn't necessarily mean that it's worse.
Yep.
And, technologically, some of the care that we can get here is so unique. And I think, I didn't know it. And most of our listeners probably also aren't aware that sometimes, the best care that can be had is actually in Japan.
Yeah. Yeah. That's fantastic. And your husband's been fine. He's been in remission.
He's been great.
Yes. Oh,
Yeah.
fantastic to hear. So, I mean, this is really interesting for me as a physiotherapist. I mean, one of the things that's we've really taught right from the start is to identify red flags and to screen for non-musculoskeletal pathology. Most physiotherapists may go through, well, a lot of physiotherapists may go through their entire career without actually seeing a serious non-musculoskeletal pathology masquerade as something that's musculoskeletal. And we try to be as thorough as possible because you definitely don't want to miss something like that. And a tumor presenting as back pain is sort of the example that's given a lot of the time.
Yeah.
And part of that is screening for things that don't quite match the normal presentation for mechanical back pain. And you mentioned night pain there, which is sort of one of the key ones.
Yeah.
In terms of your husband's management, did it take very long to diagnose it? And was he sort of being treated for mechanical back pain? And were there any other clues for you as a medical doctor that this doesn't quite seem right? It seems like it may not be musculoskeletal.
Right. Especially because he had, issues with back pain in the past.
Mhm.
So that was one thing. We're like, oh, he's going to be fine. But,
Yeah.
he was like, no, this one feels a little bit different. It's not
Yeah.
the usual pain. And it wasn't, a lot of times we injure our backs and we don't even remember, what the injury was. But in his case, there was no injury. It was actually waking him from sleep, which I think is another big red flag.
For sure.
And so it would wake him from sleep and he'd sort of pace, he'd be walking up and down the hall until it subsided. And it actually subsided with activity
Yep.
until he could finally go back to sleep. So I think those are some key red flags that I would definitely think about.
Yeah. And luckily you did go down that route because I mean, this is sort of branching off a little bit, but in musculoskeletal medicine, there's really a move away from imaging because, we see, herniated discs and all sorts of other pathology on scans that aren't necessarily relevant to someone's pain presentation. But the biggest advantage of having a high-level screening technology is to screen for non-musculoskeletal pathologies, which in some cases may be life-threatening. So it's always a tough one as me as a physiotherapist. When do you send someone for that scan? But I think as soon as you have an inkling that this doesn't seem like a normal musculoskeletal problem, you really need to get them investigated. And luckily your husband had you there to sort of speed that process up. And thank you very much for Sarah sharing that. It's a really interesting story. So I guess that you had both your father. When did he make the transition into cancer management? How long ago did he sort of?
So this was probably about 25, about 25 years ago, I think. He was doing a lot of interventional cardiology type of work for a long time and opened his own general medical clinic. And I think that's where he found that most of his patients were really not struggling so much with cardiovascular disease, but with cancer. So, what can you do that, and because he went from open heart surgery to the interventional, with catheters and trying to minimize side effects and, large treatments that would really impact the patient's quality of life. In the same way, it's like, okay, with cancer therapy, you have your big treatments, which are certainly necessary, the surgery, the radiation, the chemo, and definitely first line, definitely very, very important. But what can we do that really minimizes the impact to their body, right? To maintain their healthy cells, maintain their healthy cells, and only target the cancer. And so, what we talked about was, our immune system, right? This is like what our bodies do every day. And even though the incidence of cancer is rising, and particularly in younger and younger people, if you think about it, you and I probably have, precancerous cancer cells circulating in our bodies right now, because humans are made up of trillions and trillions of cells, right? And every day, the older cells, they die off and are replaced by newer cells. And this happens every day. And we're also bombarded by, pollution and UV radiation and, junk food, which has been shown to be carcinogenic and, a lot of things externally. So every day there's about 5,000 genetic or epigenetic changes that are going through our cells in a day. So at every single moment in our lives, we do have cells that have the potential to turn into cancer. But why we don't all end up getting cancer is because our immune cells are able to actually patrol our bodies, find these, abnormal cells and get rid of them before they take hold and start multiplying, becoming cancer. So, our immune cells have this natural ability to do this. So how can we enhance that? Right? And so that is sort of what we developed here. We take our own immune cells from a blood draw. We grow them out to the billions, and there's a fantastic cell called the natural killer cell, which people might be aware of because during COVID, this is our natural killer cells are also able to kill infected cells. So we naturally have this ability to do this. We regrow out our own natural killer cells to the billion, and then we retransfuse it back into our bodies. So that's, one therapy that we do. And then the other therapy is we actually create a cancer vaccine. So, and that is targeted to our own tumors, because you and I could have, the same stage, same type of tumor. But when you actually check out your biomarkers, your cancer biomarkers, like we may have very different levels of very different markers. So our tumors inside are very different. So, it's a very targeted, personalized vaccine that we create out of our own cells. And this is how we, target cancer. And it's by no means a replacement of your, chemotherapy, radiation, and surgery, but it's something to really boost your immune system to be able to better fight the cancers that we have.
Right. So, and so you use this in conjunction with the surgery and chemotherapy and radiation. And is it sort of done at the same time, or do you almost cycle them through? You do the treatments at the same time?
Depends on the person, and we treat everybody individually. And most of our patients, a lot of our patients have gone through all the available standard therapies and, they're out of options. And so they come to us.
Yeah.
And then we have other patients who use it sort of preventatively, because once you're treated and they say, oh, well, you're all clear. We'll see you in 6 months or we'll see you in a year. Like, a lot of patients feel very anxious and worried.
Yeah.
Like,
Yeah.
okay, well, we probably do have some cancer stem cells still lurking that can't be targeted because they're not visualized. So then they will come to us and, they're like, oh, I'm seeing a bump in my PSA. It's starting to rise, but they're doing the scans and they don't see anything. But I feel like there's like cancer that's starting, brewing within my body. And that's actually a perfect time to come and get immunotherapy, because
Yeah.
it can kill those unseen cells. Because by the time it shows up on a CAT scan, we already have 100 million cells, cancer cells in the body. So
Yeah. Yeah. So when you say we developed this technology here, was your father part of that? Oh, really? Yeah.
yeah, so my father was, a pioneer in this field as
Oh,
well.
wow.
And he started doing research in natural killer cells about 22 years ago or so.
Okay.
And he started in his clinic, offering this almost for 20 years now. And the cancer vaccine has also been available for 15 years, which is phenomenal, considering that, in most other countries, these treatments are either unavailable or they're still really in the phase where they're doing clinical trials.
Yeah.
So
Yeah.
I've been able to offer it in Japan for already over 15 to 20 years. So
Wow. And has there been much? I mean, obviously, you've researched this sort of fairly thoroughly, but what are the effects that have been shown in terms of improvement in symptoms or decrease in rates of recurrence, or
right.
what does sort of research show about these treatments?
Right. So, generally the effectivity of it is, and again, we combine it with multiple modalities. So it's hard to isolate because it's not a clinical trial. We want to give every individual the best chance they can have, obviously. So, combined with other treatments, we've had about a 10% rate of the cancer disappearing, about a 20% rate of cancer decreasing by, shrinking 30% or more, and 40% of patient being able to maintain sort of a stable, cancer doesn't get bigger, but it doesn't get any smaller. And then unfortunately, in the rest of the patient population, they continue to progress.
Yeah, but I mean, that's still still amazing results.
Yeah.
And are these treatments covered under the Japanese National Health?
No, unfortunately, that's one thing that it is, an expensive treatment, as you can imagine, because it's created with your own cells and each one is individually created in a lab.
Yeah.
That's been, ratified by the government. And unfortunately, at the moment, the Japanese government does not cover it with insurance.
Yeah. And is that something you and your father and others performing this treatment are sort of pushing towards? Is that a goal for you in the future?
Yeah, again, it's not something that, unfortunately, it's not up to us. But right now, what we're doing is we're providing the data to the ministry. And so every year we send our data, if there were any side effects versus any, our success rates. And at the moment, the ministry is gathering all of this data to see if, it's something that's viable for the country to provide, in terms of national health care.
Yeah. Yeah. And I mean, that if you were even in sort of 10, 20, 30 years time able to sort of make that change that was approved by National Health, I mean, that would be an incredible achievement.
Fantastic. Yeah, because I'm sure that, as a country, and this is the same everywhere in the world, but especially in Japan, our population's getting older and older, and a lot of resources, a lot of money is being spent, for these treatments. And if you can have a treatment that is effective and enables the person to, live a long, productive life, there's nothing better than that. And I think the best part about the treatment is that because you're being treated with your own cells, the side effects are just really, really minimal.
So that was going to be my next question.
Yeah.
Are there any side effects yeah.
So, in about 10% of the population, it would be cancer vaccine. Like with any vaccine, it does sometimes you get a little bit of a local, inflammation, irritation, a little redness, a little maybe itchiness at the site. Um, and with the natural killer cell infusion, in about 1% of the patients, they might get a slight fever for about 24 to 48 hours. So just your typical immune reaction, nothing terrible. And in the over 2,500 cases that we've done, no one's ever had a terrible allergic reaction or immune reaction that, sent them to the hospital. So.
Yeah. I mean, when you're talking about cancer treatment, side effects such as a fever and a rash, I don't think they really count as side effects.
Yeah.
Yeah. And so you said that it's been used minimally in other countries, or is it used at all in other countries? What's sort of the international spread of this sort of treatment?
Right. So it is used in certain countries. In the United States, I think there are a very few centers that do natural killer cell treatments. There aren't. There's a similar cancer vaccine called Prevenge that is FDA approved for prostate cancer, but it's only used for prostate cancer. And ours is quite different in that we use multiple targets, not just one target like Prevenge. So basically the vaccine target that is created. And our vaccine and our natural killer cell therapy is actually the way that we produce it. It is been patented in over 12 countries. So we hold patents to the technology in order to do this in a very minimally invasive sort of way.
Yeah.
So, there are other countries and other people who are doing similar things, but not quite the same therapy that we offer.
Yeah. And obviously you're very focused on Japan at the moment, but is that something that you can see in the future? Obviously given your bilingualism and also the fact that you've worked as a doctor overseas, is that something that you're looking to try and spread this technology worldwide?
Yeah, I would love to. And, we've had certain offers from other countries to try and establish labs in other countries. But right now, because it's a type of regenerative medicine, which I'm sure as a physiotherapist you're familiar with, like PRP and stem cell therapies, there are, very tight regulations about regenerative medicine in other countries. So I would love to spread it. Right now, up until now, we've had most patients actually fly in to get these treatments. And because it's such a minimal, in-office therapy that people would fly in and then fly out every, couple of weeks to get the therapies. But of course, since COVID, this has been really a challenge.
Yeah.
And that, a lot of our patients, particularly coming in from other countries in Asia, have not been able to fly in to receive their treatment.
Yeah. And I know we talked about the Japanese insurance. Is it something that is covered under like international health insurance? Is it recognized by sort of American insurance companies as a yet? Or?
Yeah, I'm not sure. I know certain people do have special, particularly, cancer insurance and insurance where, people pay up front and then they get reimbursed for it. And I think it depends on the insurance carrier. We're obviously we've provided some of our patients, a full description of the, what the treatment is, and they submit it to their insurance providers. But I don't know what the results of that is.
Yeah. So I guess coming just going back to when you returned back to Japan, you had your father's clinic, and they were performing these, I guess, innovative cancer treatments. And then you came in with your sort of lifestyle medicine background. How did you go about sort of integrating that into his practice?
Yeah. So, like I'd mentioned before, most cancer patients, they really want to know, okay, well, what is within my power that I can do? I'm sort of sent around, with all these different treatments and, it's a very hard treatment schedule. And I think particularly for cancer, there's nothing more life-changing than to be told that, you have cancer, because then you're faced with all of these fears about the mortality and it can be completely consuming, for someone. And so how do you maintain, a positive outlook and the strength that's really needed to go through, a cancer journey. So mindset is a huge part of what I do for a lot of our clients and a lot of our patients. How do you maintain a positive mindset, in order to be able to go through a cancer journey? And then what are the sort of foods, that are healthy? And it seems intuitive, but sometimes it's not. And a lot of people don't know that, if you're battling prostate cancer, that you shouldn't be overeating, red meat or eggs. The egg yolks, the choline in egg yolks can actually concentrate in prostate cancer cells. Same thing with hormone sensitive cancers and like soy. Right. And for a long time in the West, they said, oh, don't eat soy because it mimics the phytoestrogens and it could be feeding the cancers. Well, it turns out that that's absolutely not true. If anything, it helps to block your human estrogens. So, people have a lot of questions about what's good to eat, what's not good to eat. So I help them with making their dietary choices, help them with sleep, help them with exercise. Exercise is one of the best things that you can do for cancer. And a lot of people are kind of afraid to work out and exercise and do these things. Whereas it's been shown that, especially for breast cancer, the more you exercise pre-diagnosis, right, the better chances you have. Even people who've never exercised in their life, if they start when they're diagnosed with cancer, they actually have a much better outcome.
Yeah.
And for people who are survivors, like 50 to 60%, your risk of recurrence is decreased by 50 to 60%, which is like better than any drug, any treatment that you can have. So lifestyle is extremely powerful.
Yeah. Yeah. And so I guess one thing I didn't ask, the work that you're doing in your clinic, is it predominantly with Japanese? I know that, you're very active in sort of the expat community, but do you have many foreign clients, foreign patients coming in? Yeah.
Yeah.
And I guess,
Most, we started out predominantly the Japanese patients. And then for, pre-COVID, a lot of our patients, I would say about 70% of patients were actually flying in from abroad.
really, yeah.
When that got shut down, we're obviously struggling like many, many companies all around, companies and clinics all around the country. And so, I realized people were shut out from coming into the country, but in much the same way, the expats in our community, they were shut down from leaving,
Yeah.
right? Because if they left, then they didn't know when they would be able to come back.
Mm.
And to really, I really wanted to do a lot of outreach to our community that, you can get fantastic care in Japan. You do
Yeah.
have other options that you probably don't know about. So, I really wanted to let this therapy be known to, patients who were potentially feeling stuck.
Yeah. 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 And I guess the next part of my question was, did you note a big difference in the sort of mindset between the foreign patients and Japanese patients in terms of how they sort of took on that information around the lifestyle piece and their sort of willingness to integrate that?
Yeah, absolutely. I think for a lot of Japanese patients, they're unused to, right, really standing up for themselves and, fighting for themselves, having agency and fighting the doctor saying, no, 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 I want another test, or I want, I think the Japanese population is much more compliant in saying, okay, I'm just the cog in the wheel and I will go around and do whatever you tell me. And I think the Japanese medical system is used to that. But
Yeah.
here we actually really encourage people to get second opinions, third opinions. You need to be satisfied with the care that you get. You need to be convinced that this is indeed the best thing for me.
Yeah.
And so I think the foreign patients that I see are much more proactive in seeking out, what else is there out there for me? If doing, high dose IV vitamin C treatments are good for me and my stamina and my immune system and being able to fight cancer versus, just doing the traditional therapy.
Mhm.
So I think we welcome people because I love working with the expat population because they're 100% into it. They want to do what's best for them, and they have questions and what is right for me. So I think that's really, really important in realizing that you have your own agency and that there are a lot of things that you can do.
Yeah. 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 That's amazing. It's fantastic information there. For people that I guess there's a few groups of people that may be interested in getting in touch with you or following you. Obviously, for cancer patients, if they haven't already found you, and they're interested in maybe looking at this as an adjunct to their current management, how should they get in touch with you? And obviously, we'll provide all the links in the show notes. But your website, do you have a bilingual website for your
We
clinic?
do. It's called the Tokyo Cancer Clinic. So it's www.tokyocancerclinic.jp. And then there's an English tab. You just hit the English button and it'll come up for you in English for more on coaching and lifestyle. And I work with other patients as well, not just cancer, although that's really my specialty. And it's drminako.com.
Yeah.
That's all in English.
And in terms of social media, I know you're quite active on Facebook and you're often posting things there. Is that your sort of main social media outlet? Are you on any of the others, LinkedIn or Instagram, Twitter?
Yes, I am on LinkedIn and Instagram, but I am most active on Facebook, and that's probably the easiest place to find me. Dr. Minako also there, or Minako Abe, and you can just search on me and friend me, and I'm happy to answer any questions, or if anybody's having, certain questions or qualms about, what to do. I'm here to help.
Yeah. And I know you've seen you quite active on forums like the Tokyo Expat Network, and you're obviously very sort of generous with the time and advice that you share, which is much appreciated by the community. I guess before we wrap up, do you have any other sort of final messages or things that people should be thinking about?
Well, I think my biggest message is really that, we are not powerless, that we do have so much that is within our control. And I like to break down lifestyle medicine into sort of 4 pillars: eat, sleep, move, and relax. And all of these 4 things are so instrumental in, boosting your immune system, being able to fight cancers, and just staying healthy. So, eating, whole nutritious foods from the way they came out of the ground mostly. And sleep. Sleep is one of those most undervalued things, I think, that, just one night of lack of sleep, like from 7 hours to 5 hours, is shown to diminish your natural killer cell population by up to 72%. That's huge. And, we all have nights of lack of sleep, I think, but just to be able to prioritize sleep, because we function so much better. Our moods are so much better. So sleep, move, obviously, exercise is so important, not just for our bodies, not just for our immune system, but mentally, emotionally. It's like everything. And then relax. It seems easy to say, relaxation, but just being mindful of things and being able to consciously relax and choosing relaxation for our bodies, because we do need rest. And that's when our immune system is also activated, while we're sleeping, while we're resting, tamping down that fight or flight, sympathetic response, and just a more caring, sympathetic, parasympathetic response, and our happiness hormones, and boosting that, and being able to do all of that is going to go a long way. And all of those things are just within your control. So I think that's my biggest takeaway and my biggest message for everybody.
No, that's a perfect way to wrap up. Honestly, I mean, I think you're the perfect guest for our podcast. A lot of the things that we stand for at Club 360, especially the patient-centered care, putting the patient right in the center of everything that we do. Having a holistic lifestyle management approach to chronic disease is one of the things that we focus on as well. But also the innovation that you're doing, and also just giving back to the community. So I think what you're doing is absolutely amazing, and keep fighting the good fight. And thank you so much for coming on the show today.
No, thank you so much for having me, and I love your show, and keep putting out that great content for everybody. Thanks so much.
All right. Thank you, Dr. Abe. Have a great day.